My name is Cristina Anguita and I am 36 years old. I'm currently living in Barcelona and this is the place where I was born. And I'm an anthropologist. Well, I heard about this initiative through my work colleague and friend, Elena Marban, who is the chief of this network. And I would like to get more involved in this initiative because I think it's a good place to connect with young researchers, especially in this context of global connection. So yes, it's a good initiative. Now I'm currently working as a social scientist for the Maternal Child Reproductive Health Initiative at IES Global at the Barcelona Institute for Global Health. And I am mainly coordinating a qualitative study within a socio-anthropological approach, and that it's aiming to assess the acceptability of a new intervention for preventing malaria in pregnant women in 4 African countries. So this is my main project, but then within the initiative there has been other projects where I'm involved. And for example, recently I am working on designing a strategy of community engagement for a new project that is going to be implemented in some months, that is also related to preventing malaria in children in Sierra Leone. It's a long time ago, but I started my my studies in psychology, in fact. So I have a degree in psychology, but during my studies in psychology, I started to specialize in social psychology, and I did some subjects on cultural psychology too. So then when I finished, I felt that maybe my place was in social anthropology. And well, I continue with the master, and then I enrolled in the PhD. And I finished my thesis at the beginning of 2019, and happily I finished it. And in fact, my idea was to build a career in academia, but in fact. When I finished the PhD, in fact, I was unemployed because, well, during all my training, I combined working with the studies. I didn't have many opportunities in applying for grants because I also suffered from the 2018 crisis where all the grants were diminished. So I finished my PhD unemployed, and I realized that in fact I didn't feel comfortable in searching for postdocs, and what I wanted really to do at that point was to explore what is called applied anthropology, and in fact I was thinking also in creating a kind of profile as a consultant. And then, well, I found this offer at IES Global, and at that time it really fit my expectations. And also during my training, I had the opportunity to be in touch with the world of NGOs and development. I had a job in Cameroon a long time ago. So I've always felt that anthropology had something to say in these domains. So that's why I finished this. That's why all this path led me to the position I have right now. Looking back at my experiences, I think that the key aspect, at least for myself, was honesty. And trying to think the good things that I've learned in previous experiences, right? So before I was explaining that I've always worked in many jobs, in fact, not related to anthropology or my training. And at some point I felt, I spent some time thinking that I felt a bit shy about about working in, I don't know, in survival jobs, right? But then I realized that I've learned a lot during these experiences, and that's what what I've always tried to transmit during applications and interviews or whatever. So in fact, it's talking about honesty and how you can take advantage of any experience you have had during your life. And also in this sense, in fact, there's also perseverance at the background of this feeling of honesty. So that's a difficult question. No, I think that for me, working in anthropology, in fact, it was the domain I was feeling comfortable with since the beginning, almost since the beginning, because it allowed me to pay attention to diversity and equity, paying attention to specific details, or even if talking from a privileged position as a white woman, I think that it allowed me to give voice to other people that doesn't have space. So I think that it's through anthropology that with this narrow perspective of the social phenomena can build a complex description of society, so that all groups can be included, right? So I'm talking about minorities, I'm talking about women or indigenous people. So I think that is in this sense that I think that anthropology is giving me the opportunity to fulfill my objectives in life, no? Yeah. Okay, so well, professionally, in fact, apart from health, global health, that is my current domain of work, I've always been specialized in African context. So, and mainly in indigenous peoples in Africa, applying a decolonial and post-colonial perspective. So these topics still interest me a lot. I'm very interested in African history and colonial history, and especially also living in Spain, in fact highlighting the colonial past of Spain in Africa that sometimes is a bit overlooked. And then at a personal level, well, I think that I think that it's more the common issues of everybody, like traveling, being with friends, And I also like to play music. I really enjoy spending some times with myself, trying to play the guitar. I'm also reading. But yes, in fact, having a space, a little time and space for myself is one of my main interests. As I didn't come from the domain of health, there is the field of anthropology of health, for example, but in fact was not my specialization. Once I started to work in global health, I think that my concept of health has been broadened, right? So I think that I could open my mind to understand that health is more than going to the doctor, right? And understanding that when talking about health, we are talking about well-being, and well-being involves a collective perspective. It involves talking about economics, it involves talking about the environment, the political system, the connection between societies. So yes, I think that global health means to open the mind and understanding the human being in all his complexity. I think that working as a global health professional, and especially with my position as a social scientist, as an anthropology, I think that it contributes to having a complex photograph of global health, right? So I think that related to what I was saying before, I think that I can contribute to give voice to other people that are affected by health issues and within a broader perspective. And I think that, for example, I'm really happy in the projects where I'm currently engaged. I'm really happy to be able to translate the voices of pregnant women living in rural areas. And I'm happy to be able to work with the information they directly give us. So I think that it's this complexity that I can offer to the picture, to this great picture of global health. Okay, I think that since in global health, what I've learned is that we can provide a broad picture and engage in different disciplines. I would say that everyone can find their space within this global health perspective. So I would say that they should not give up if they are interested in global health. I would suggest them and encourage them to not give up and try to find their place whatever their training or their position is. So yes, I think that this is what I would have loved to listen when once I finished my studies. So that's what I would suggest.